Treatment of milk fever according to D.C. Blood uh, textbook of veterinary medicine. The treatment of milk fever is that every effort must be made to treat affected animals as soon as possible. As soon as possible, we observe that an animal has the milk fever, we should have to treat it as soon as possible after clinical signs are obvious. What are the clinical signs? Clinical signs may be that the animal is recumbent or laying down in lateral. It may be lay down in lateral recumbency. It may lay down on the sternal recumbency. But the ideal situation is that we should have to treat the animal before the animal is recumbent. Treatment during the first stage of the disease, that is called as the first stage of disease, in which the animal is not recumbent, it is on standing position, or it is lethargic like that. Treatment during the first stage of the disease, before the cow is recumbent. Before the cow is recumbent, it means that cow is not recumbent. If the cow is not recumbent, it is the earlier stage of milk fever, and it's the ideal situation to treat the milk fever, that treated before recumbent. But it is, in field cases, it is almost impossible or difficult to detect that an animal is in the first stage of milk fever by the veterinarian and also by the farmer. Uh, just because that provided that if farm or a big herd where there are many veterinarians or a veterinary team who are observing the animals continuously, or after 1 hour or after 2 hours, then they can detect the milk fever. But that is the ideal situation, and not all the animals are blessed with this ideal situation, that they if a veterinarian have an eye on them. So in the second situation is that, for example, we are unable to treat the animal in ideal situation. For example, in ideal situation or before the recumbency of animal. So the second step is that the longer the interval, if the animal is recumbent, then it should not have to recumbent for more than 4 hours. The longer the interval between the time the cow first becomes recumbent and treatment for the greater the incidence of Downer cow syndrome. For example, if a cow is recumbent for more than 4 hours due to the milk fever, then there are more chances that the cow will become a downer cow. Downer cow means that for example, a cow is recumbent on the left side, then the muscles of the left side will have the pressure of whole of the body, and that muscles due to that pressure, the muscles will have the ischemic. They will become ischemic. Their oxygen supply to these muscles is decreased, or there may be no oxygen supply to these muscles, and due to these absence of oxygen to these muscles, the muscle will go towards necrosis. These muscles are necrotic, become necrotic due to the pressure of the animal on the side on which the animal is recumbent. If animal is recumbent on left side, the left side muscle necrosis. If animal is recumbent on right side, there may be the right side necrosis. So the treatment should be done in ideal situation before the recumbency, or if the animal is recumbent, then it should not have to recumbent for more than 4 hours. It should have to be treated before 4 hours. The more than 4 hours may cause the Downer cow syndrome. Complication of milk fever occur when the cow has been in sternal recumbency for more than 4 hours. If an animal is in recumbent on any side, not on sternal recumbency or on left lateral or right lateral, any recumbency position for more than 4 hours can cause the Downer cow syndrome. And if the cow and more complications are if the cow is in sternal recumbency for more than 4 hours, then it will have the more complications. Farmers must be educated to appreciate the importance of early treatment. What does this mean? This means that farmers are afraid of calling the veterinarian because of the high fees of the veterinarian. So farmers, they do not call the veterinarian in early stages because it is not always true that if after parturition if an animal is recommend, then it will always have the milk fever. So farmer assume that this animal do not have the milk fever. It is recommend just because it has decreased energy just because of parturition stages. So they consider that after 1 2 3 or 4 hours the animal will become active after eating or like that. But we should have to there should be some training programs for the farmers in which we can teach them that how can they differentially diagnose or they can detect that which cow is laying down or is recombinant due to milk fever or is laying down or recombinant due to the less energy or due to the energy stress. So if the farmer detect that animal has the milk fever, then they should have to call the veterinarian. Or if the animal is in the same position, recommending in same position, left recommency, right recommency, or sternal recommency, the farmer, if the animal is for more than 4 hours or more than 3 hours, then he should have to call the veterinarian, or at least he should have to change the posture of the animal if it is possible, so as to avoid the ischemic muscle necrosis of that site. So cow found in lateral recumbency in third stage of the milk fever, the cow uh, go to the lateral recumbency. It may be the left lateral recumbency, it may be the right lateral recumbency. In third stage of milk fever, when the cow is in the lateral recumbency, it should have to be placed in the sternal recumbency. Why? Uh, because this will facilitate the eructation. Eructation means the out to the move out eructation and reduce the risk of aspiration if the cow regurgitated. Eructation means removal of gases through the mouth from any animal. So eructation means the removal of gases is facilitated as the abdomen body will have the pressure on the rumen, and that pressure on the rumen will facilitate the removal of the gases or outflow of the gases from the mouth, and it will also help that the regurgitated food will not is not aspired, means it will not go into the lungs. So means to say that in third stage of lateral recumbency, animal should have to place in the sternal recumbency. It will have two benefits. One benefit that it will facilitate eructation. Eructation means removal of gases, and other is that it will reduce the risk of aspiration, that food that is the cow is gurgitating or that has gurgitated it, or it is in the esophagus, it will not, or in the mouth, it will not go into the lungs, it will go into the esophagus. It will not go into the respiratory system. Cow that have difficulty finding solid non-slip footing. Cows. Another thing is that the cow that are recumbent, they should have they should have to be on a solid and non-slip footing. Footing means the place where they are recumbent, or the floor. They should have non-slip floor beneath them. Beneath them will often not try to stand if there is soft floor, not specific for cow, any animal, or if a human being is recumbent, or if it is fallen down, the space is not solid or it is slippery. We will find anyone will feel difficult to stand up, and humans can stand easily as we do not have very much weight. The weighted person or the obese person also feel difficulty in standing over the slippery or the non-solid place. So as the cow, their weight is very much, so they should have to be provided by a non-slip footing or non-slip floor, and it should also have be should be solid, not slippery, definitely solid, so that if they have the power, a little bit power, they want to stand, they make effort to stand, they can stand up. If the animal has the power to stand, or if it try to stand and the place is slippery, then even with little bit power or with the available power, it cannot do so. Awareness of this complication necessitates the placement of rubber. We can provide that slippery, solid or non-slippery space. How we can provide? We can provide it with placing the rubber or other mats. We can place rubber or mats, but in field conditions, it is not possible because the rubber or mats that are used for animals, they can be provided in the commercial dairy farms, but a farmer who has two or three goats, it is impossible for him to purchase the rubber mats for that. So what he can do, he can place the animal in uh, a place where there is very much grass. Transportation of car to a piece of pasture with a dense sward on it. Sward means pasture or the grass. He can move the animal if it was possible for him in the pasture that has the dense grass. Then dense grass will also make the that place little bit hard, solid, and non-slippery.